ears. Today we're going to be doing a full head to toe assessment. How are you doing today? Good. Is there anything you need before we get started? Miss White is coherent and alert. She is dressed appropriately for the situation. We took her vital signs earlier. Her blood pressure is 117/75. Her heart rate is 75 beats per minute. Her temperature is 98.7. We took her height and weight, and we did a sun eye chart as well, and her vision was 20/20 with no mistakes, which means she can see at 20 feet what people normally can see at 20 feet, so she has perfect vision. And we are going to get started on her head to toe assessment. Alright, first we're going to start with the head. The face is symmetric. The head is normocephalic. Could you smile for me? Good, and puff your cheeks. Alright, cranial nerve 7 is intact. And then I'm going to palpate your head. Let me know if you feel any pain or tenderness. Alright, no pain or tenderness as well. And then I'm going to palpate your sinuses. Let me know if you feel any pain or tenderness in there. We're going to start with the frontal sinuses, ethmoid, sphenoid, and maxillary sinuses. No pain or tenderness there. And then we are going to your jaw. Can you open and close your jaw for me? Good. No popping, and then clench your teeth together. Good. Jaw is symmetric and strong, and there's no popping in the jaw. I'm going to have you close your eyes, and I'm going to put something on your face. I want you to tell me, just cotton ball, nothing like that. And tell me, say now whenever you feel it touch your face, okay?
No.
Good. Cranial nerve 5 is intact with motor and sensory function. So first we're going to feel your lymph nodes. Preauricular lymph nodes, posterior auricular lymph nodes, occipital lymph nodes, submental lymph nodes, submandibular lymph nodes, jugular-digastric lymph nodes, superficial cervical, deep cervical, posterior cervical, and supraclavicular cervical. All lymph nodes are non-palpable. We are going to also feel your trachea and your thyroid. So your trachea, good. Can you swallow for me? Good. The trachea is midline and symmetric with the neck. And then for your thyroid, I'm going to come back here and we'll put a little pressure on it. You can swallow for me. Good. And the other side swallow. The thyroid was felt when she swallowed. Okay, and now we're going to move on to the eyes. We're going to do confrontation test first. Just put this over one of your eyes. Good, and let me know when you see my fingers coming into view.
Yeah.
Good? Good, now do the other eye. Right, is there when you see my fingers coming in? Good, confrontation test was good. Your vision is good. Optical nerve 2 is intact. Alright, the eyes are symmetric with the face, the eyebrows are symmetric, eyelashes are evenly distributed. We're going to do a little test for you now too. If you could look straight ahead. Good. They react to light, and then look straight ahead again, and then focus on your finger. Good, they accommodate. So pupils are equally round, react to light, and accommodate. And then we are going to look inside the eyes. That way might not promise you, okay? I want you to look straight ahead. Good. The red reflex is seen. The optic is creamy yellow with round, distinct margins. The maculocene and the retinal vessels are present and normal. Now we're going to do your other eye. Look straight ahead for me. Good. The red reflex is seen. The cornea, or the optic disc, is creamy yellow, and the retinal vessels are present and normal. Now for the ears. The ears are equally bilateral and symmetric. There is no swelling. Is there any tenderness? Now I'm going to push on your tragus for a second. Let me know if you feel any tenderness or pain. Good. Tragus is firm with no tenderness or pain. And no discharge is present at this moment. And I'm looking at your ears now. Good. Tympanic membrane is the silver grayish color. The corneal reflex is the in the anterior inferior quadrant. Here, and no discharge was seen in that ear. Good, and there's even tympanic nephritis seen too, and there's also a pearly gray color, and the cornea reflex is seen in the anterior inferior quadrant. Now I'm going to do a hearing test on you. If you could cover up one ear, I'm going to come behind you and I want you to repeat what you hear me say.
1, 2, 3.
Good, now cover the other ear.
ABC.
Good job. So her hearing is good, so cranial nerve 8 is intact. Now we're going to move on to the nose. First, one more thing with the eyes. I'm going to test your corneal reflex, okay? Right, look straight ahead. Good, corneal reflex is good. The light is equally bilateral in both pupils. And then we're going to do test your muscles of your eyes. Right, follow my finger over it goes. Good. Good, cranial nerves 3, 4, and 6 are intact. Now we're going to move on to the nose. Can you put your head back a little bit for me? Good. Good. Nasal mucosa is moist and smooth. There is no deviated septum, and the medial and lateral turbinates are present with no swelling. Could you open up your mouth for me? Say ah. Good. Uvula rises with soft palate. The anterior and posterior pillars move medially. Open again. The tonsils are pink with a grade of 1. The buccal mucosa is pink, soft, and moist. Stetson's duct is seen. If you could lift up your tongue, move your mouth. Good. The frenulum is intact in midline. Wharton's duct is seen. The teeth are white and symmetrical and free of debris. And now we're going to test out your taste. I want you to taste this and tell me what you taste.
It's sweet.
Good. So cranial nerves 9, 7, and 10 are intact. Now I want you to close your eyes and I want you to tell me what you smell.
7.
Good. Cranial nerve 1 is intact. Okay. Now we are going to move on to your lungs. So I'm going to first put my hands on your back to feel your lung expansion, okay? I want you to use big breath. Good. There was no lag and the gums move symmetrically. I'm also going to test your costovertebral. So if you feel any pain, okay? Good. No pain to stop. Right now, I'm going to palpate your back. I want you to say blue moon for me.
Blue moon. Blue moon.
Actually, this is the tactile premise we're going to do. Say blue moon.
Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon. Blue moon.
Good. The vibrations were heard. They were symmetrically heard throughout the chest wall. And now we're going to palpate for any lumps or masses. Good. No lumps or masses were felt. I am going to listen to your lungs now. I want you to breathe through your mouth and take deep breaths in the lower one, not too deep. Good job. And then up here too. Good. No crackling or adventition sounds were heard. Normal breath sounds were heard. The bronchial sounds were heard above around the trachea. The bronchial vesicular were heard around the sternum area, and the vesicular were heard in the peripheral lung field. So now we're going to listen to some of your pulses. Right, first, your radial pulse. Good. Radial pulse is strong and normal too. We're going to do your capillary refill. Good. Capillary refill less than 1 second. The brachial pulses, they're equally bilateral. Let's see your Achilles tendon pulse. Good. And dorsalis pedis. Good. They are both strong and with a good rate and rhythm. Alright. We're also going to check your deep tendon reflexes. First, we're going to do your brachial reflexes. your weight on me. Good. Alright, and now the triceps. Deep tendon. Good, and the other arm. There you go. Bar your weight on me. Good. And triceps. Right now your patellar tendon. Can you uncross your legs for me? Very good. And then your Achilles tendon. Good. Alright, all reflexes were normal and a 2+. Now we're going to listen to your heart. First your carotid arteries and then your heart. Good. Alright, the carotid artery is a good rhythm with a louder upstroke than downstroke. I'm going to listen for any brutes. I want you to take a deep breath and hold it after you exhale. Good job, thank you. No brutes were heard. And now we're going to listen to your heart. First the pulmonic area, then the aortic area, the tricuspid area, and the mitral area. Good. All heart sounds were heard, S1 and S2. The rate and rhythm was good, and there was no extra heart sounds or murmurs heard at this time. Okay, let me see. As we can see from me, can you stand up straight for me? Good. The spine process is straight, and the scapula and the thoracic region are symmetric. Alright, I'm going to have you lay down on the bed now, please. This way, thank you. Here's some place for your feet to go. We are going to be looking at your abdomen. You can see from here that your contour is flat. Go ahead and lift yourself, please. Put your shirt up. And take a deep breath for me. Good. Abdomen is symmetric. Take another deep breath. With no visible lumps or masses at the time. Alright, first I'm going to listen to your stomach or your abdomen for any vowel sounds. This will be so cold. Good. Normal vowel sounds are heard. I'm also going to listen to some arteries in here to make sure there are no brutes or your abdomen. First, the aortic artery. Good. The right renal artery, the left renal artery, the right iliac artery, and the left iliac artery. Good. No brutes were heard. We want to percuss on your abdomen now. Good. Tympani was heard throughout the abdomen. Now I heard the doctor told me that you were ticklish, so I'm going to be popping your stomach so you can put your hand underneath mine if you like. Beginning. It's going to be light palpation first. Let me know if you feel any pain or tenderness while I'm doing this. Good. Now we're going to go a little deeper, okay? Is it ticklish? Alright, no lumps or masses were found in the abdomen, and there was no tenderness. Now we're going to do your liver. Alright, and then your spleen. Big breath for me. Good. Alright, spleen and liver were not palpable, and no lumps or masses were found. Alright, while I have you laying on the table, I want to do your range of motion for your hips. So if you could bend one of your knees for me, good, and straighten it up in the air. Perfect, bend it back, and then do internally rotate it, outernally rotate it. Make the leg straight, and then I want you to abduct First abduct this one, this way. Good, adduct. Perfect. Now with the other leg, straight up. Good, thank you. And then internally rotate, externally, and then abduct, adduct. Perfect. Full range of motion in the hips. All right, you can have it. You can stop now. All right. We are. We're going to do a few more ear things for you. I'm going to feel the ears, they're good. We're also going to do a Wren and Weinberg test. Test your the vibrations, okay? First we do the Weinberg, or the Weber, which is in your bony premise right here. So tell me when I say now whenever you stop feeling the vibrations. Alright, and then look close to your ear now to see. Tell me now when you hear the vibrations, stop the vibrations. Good. The Weinberg was twice as long as the Wren. Okay, and then we are going to do your skin. Your skin is evenly pigmented. It is warm to touch. There's no moisture on the skin. Do your turgor. I'm going to pull up on your skin right here. Good. Skin is easily pulled and retracts quickly. Alright, now we're going to do some range of motions. For our neck first, can you flex your neck like this? Extend. Good. And laterally bend it to this side. And then rotate it. Good job. Alright, you can stand up. We're going to do some more range of motion tests. We are going to externally rotate them. Good. Internally rotate them. Abduct them. And adduct. Very good. And with your elbows, you're going to flex your elbows. Extend them. Pronate them. Supinate them. Good. Full range of motion in the arms and neck. And now we're going to do the legs. So with one, stand on one leg, and the other one, I want you to flex your knee, extend it, hyperextend it. Very good. And then with the other knee, flex it, extend it, hyperextend it. Alright, full range of motion in the legs. Now we're going to test for the streak. I want you to stand on one knee. Don't lock your knee completely, but do a shallow bend. Good. And the other knee, shallow bend. Alright, full strength in both of our legs. And then I want you to put your arms like this. And don't let me pull down. Good. Full strength in both arms. Alright, can you come right here for me? And I'm going to have you walk 10 feet this way and then back. Very good. Come back. Gait is very smooth and rhythmic. Arms are swaying continuously with the legs. Now we're going to do test your cerebellar function. If you come stand right here, I want you to put your legs together, arms by your side, and close your eyes for 20 seconds. Alright, you open your eyes. Good. Cerebellar function is normal. And then we're going to do a few more tests with your neurological. I want you to hold your arms like this and do a finger to nose test. And you're going to put your finger to your nose, other finger to nose, and then get faster. Good. Cerebellar function is normal as well. And then we're going to do a few sensory tests with you. I want you to close your eyes and hold out your hand, and I want you to tell me what I put in your hand. You can move it around as much as you like. It's a key. Good job. And now I'm going to draw something in your hand and tell me what it is. 0. Good job. So sensory function is normal. You can have a seat right here. I'm just checking something for you. One more thing before we're done. I'd like you to stand up again. I'm sorry. Do it one more time for me. And face that way. I'm going to look at your spine when you bend over. Good. Your spine is as shaped. And then we're also going to test your spine for range of motion. So I want you to bend laterally this way. Good. And bend laterally this way. Good. And then rotate. Good. So you have full range of motion in your spine as well. The doctor should be in a few minutes, and I will see you later. Thank you so much, Ms. White.